Hi, welcome back to the Nurse Preceptor channel. I'm Hillary and I'm your Nurse Preceptor, and I wanted to talk to you today about the use of the N95 mask. So there's been a lot of press about the N95 mask in recent weeks because of the flu season and the coronavirus outbreaks. And these masks have largely been sold out in stores for about a week or so and in very short supply even as of a few weeks ago. So I wanted to show you a few examples of what these masks look like. The N95 is a designation given to masks that filter out 95% of particles that measure 0.3 microns or larger. So basically it filters out the really tiny particulate matter in the air that you can't see but that can get down into your lungs. And it should filter out about 95% of those particles if it's used exactly correctly and if it fits your face really well. This is a standard surgical mask which does not do any of that. If you are someone who's breathing out, coughing, if you are someone who is ill, if you put this on your face like this, it keeps everything you're coughing in here, and very little of it can get out, and it basically prevents you from being able to spew your germs all over your own environment. The N95 mask, we used it in the hospital a lot to protect ourselves from people who had very infectious airborne diseases such as tuberculosis. We would have to be fitted for them annually, and I never had a really easy time getting a good fit on these masks. For the record, they're really tricky. If you have facial hair, a narrow face, a really wide face, a thin chin, a thick chin, you're not going to get a good seal at all. So I'm going to show you how to put these on. So this is just one model, but they all are more or less the same. There is a nasal bridge that has a wire, and what you want to do is put your finger in it and kind of make a little spot for your nose to go. Okay, kind of tint it up like that. And you've got straps in the back that are going to go on like swimming goggles. Put your chin through, pull it up over your nose. If you have glasses on, you want to pull it kind of under your glasses. One strap goes up, one strap is going to go kind of down toward the base of your head. It fogs up your glasses a little bit. Pinch your nose, pinch the nasal bridge, and try to get as good a seal as possible. Okay, so this is what it looks like. This is why we call it a duck bill mask, because it looks kind of like a duck. And it gets really hot. You do have to work a little bit harder to breathe. It gets stuffy. It messes up your makeup. It's inconvenient. More than anything, it's just very hot and uncomfortable. When you're taking one of these off, I do want to point out that if you reasonably think that you have been in an area of contamination and you're not wanting to maybe, get any kinds of microbes on your hands, what I would recommend doing is getting just surgical gloves that are clean. And the way that you want to take this off is to pull the mask away from your face and up and over. Okay? And that just did wonders for my hair, didn't it? Anyway, what we want to do at this point is you want to fold the mask in half, take off your non-dominant glove over top of the mask and take it in the palm of your dominant hand and pull that glove up and over the whole package. And now we've got a nice little disposable package. Do your hand hygiene, and you should prevent the spread of infection that way. So I want to just say that, if you're pulling and tugging at your face, you are risking contaminating yourself if you've been maybe in an area where you might reasonably expect to have come into contact with something like the flu virus or other viruses. So the best strategies I can give you are these as far as trying to keep yourself from becoming infected. I wouldn't rely totally on masks as a false sense of security. It's still better than nothing. However, I would try to avoid going out to crowded places unnecessarily and try to avoid anyone who appears obviously ill. Take good care of your hands. Use really good hand hygiene. Wash as frequently as you can. Use hand sanitizer that's alcohol-based. Keep yourself really, really well hydrated. Drink a gallon of water a day if you can. Drink more if you feel like it. It's not going to hurt anything. Get enough rest. You know how much rest you need. Make sure you get good nutrition as well. Take good care to avoid smoking, avoid alcohol consumption if you can. and manage your stress. When your stress level goes up, your cortisol levels go up in your body. That's your fight or flight hormone, and it causes your immune system to be somewhat stunted. So take good care of yourself. Manage your stress. As far as supplements, there's not a whole lot of really conclusive data to support their use. However, for what it's worth, I take daily B vitamin supplements, C vitamin supplements, and D vitamin supplements. It doesn't hurt anything, and your body can get rid of the B and C vitamins that you don't use. All right, so stay well, stay hydrated, stay healthy, and like, share, subscribe. I will have so many more videos coming up. All right, take care. Bye.